Are you building muscle? If not, you need to begin. So I'm finishing day 5 of my 5-day blood sugar challenge, just raising awareness as to why blood sugar is so important to our health. So day 5 is all about joyful movement, and I just finished out my workup down here in my basement. I want to let you know, working out, moving your body doesn't have to be complicated. I've got some weights, I've got a whiteboard to keep track of my schedule, and on the other side of this, I've got a mat on the floor. I set up my home gym for under $150 just at Walmart, but you don't need much. You can use your body weight. But why is it important? I want to share a few things with you. So what does the science tell us? This was just released this year, 2025, and it talks about muscle quality index is correlated with insulin resistance. So what does this mean at the end of the day? So many of you may not have heard about insulin. If you haven't, you really need to, because insulin is the driver for cardiovascular disease, so heart disease, stroke, diabetes, cancers, Alzheimer's disease. And you want to be able to know ways to overcome it. So if you can see this graph that I've posted, you can basically see a line that's coming down. It's going from right down to left. So what do we know? The more muscle you have, the less insulin resistance you have in your body. So if you want to overcome any of those conditions, you need to move, you need to build muscle. That is one of the key factors that you need to do. We know when we look at longevity studies that people have greater muscle mass live longer. Now you can see me, I'm a petite frame, right? And so I have to work even harder at building my muscle mass. And as I've gone through menopause, I also saw that my muscle mass went down. This happens to a lot of female in their 40s into 50s, and in men it starts to pick up late 50s and into 60s. So you have to work harder at it. We live in a world where we don't actually exercise to get our food. We're not the generation that we were before. So if you are not training your muscles will get weak. As they get weak, they don't allow the insulin to kind of come into the cell, and our body gets more resistant. As the insulin becomes more resistant, our blood sugar rises, and it starts to cause all of those complications that I spoke about: heart disease, blood pressure, stroke, diabetes, cancer, and Alzheimer's, right? So I want you to start thinking about how you can start to move your body. It is a fundamental thing that we need to do. If you want to be healthy, you need to move. Now, because I'm just going back to really strengthening, I started out light. I'm doing 15, 20 minutes a day. I'm doing like a body workout. I'll show you what I'm doing. I think it's going to be backwards, but I'm doing rows, push-ups, lunges, crunches with the ball, squats, leg lifts, plank, and then I finish with the pigeon stretch and side to side. So I'm not doing anything super complicated. It's my body weight for the most part, but I'm already beginning to notice changes, and it's only been just a week. So begin to think how you can move in your day. Now we know that strengthening is key. Things like squats, lunges are so easy to do. So think about how you can take the steps more, right? My little workout room is in my basement, but I also have a 2-story house. So I'm up and down the steps. So do that as much as possible. But think about it. If you're trying to overcome illnesses or disease in the body, you need to move. And one of the big categories, I guess, that I didn't even speak about was mental health and anxiety, because we know blood sugar insulin resistance is also correlated with conditions like anxiety, bipolar disorder. And we know that when blood sugar levels improve, that those individuals with those conditions start to feel better as well. So think about it. And if you want to learn more, today at noon, Friday at noon, I'm hosting a free Zoom. So this is the end of my 5 days of blood sugar challenge. We're going to go over all the highlights of the week. And then if there's any questions that you want to ask about blood sugar, metabolism, or weight loss, I'll be there for you today at noon. The link's going to be in the bio. Hope to see some of you there and get moving your body.